Hello and welcome back to our class. And today we'll be talking about the evidence-based different kinds of disorders where we can use CBT. Let's start. All right. So if we see evidence-based applications of CBT, we have in CBT, we have a very strong evidence base that it supports its effectiveness for various kind of mental health disorders. Okay, so starting from depression. CBT was originally developed by Aaron Beck, as we have already discussed. So in CBT, it helps in various ways and various modalities may in depression. So first of all, it identifies and challenges the negative thought pattern that a person has been feeling and contributing to the low mood, encourages the behavioral activism to avoid the inactivity, and teaches people with problem solving to manage the stress and in a very effective manner. So what are the evidences? So for example, if we talk about the National Institute of Healthcare and Excellence, so it will recommend CBT as a first line of treatment for depression. And meta-analysis show that CBT reduces depressive symptoms by 50 to 75%, particularly on those who complete the treatment. Then CBT for anxiety disorders. So CBT is effectively effective for various anxiety disorders like GAD, generalized anxiety disorder, panic disorder, social anxiety disorders, and phobias. So how does it help in anxiety disorders? They help individuals identifying the cognitive distortions that fuel the anxiety, like for example, catastrophizing or overgeneralization. Utilizes exposure therapy to gradually desensitize individuals to their fears. Teaches relaxation techniques and mindfulness to manage their physiological symptoms that happens in anxiety. So what are the evidences? So landmark study by Butler in 2006, they found that CBT has a high success rate in treating anxiety for a long-term benefits, okay? So even for WHO or American Psychological Association, they use CBT as a prime treatment for anxiety, okay? And in exposure-based therapy, CBT has been shown to be particularly effective in treating phobias, panic disorders, helping individuals confront their fears and also control the in a systematic manner. Then if we talk about CBT for trauma and PTSD, in CBT, it helps PTSD for a gradual exposure therapy. It allows individuals to confront distressing memories in a safe and a controlled environment or in a controlled way. Right. So in cognitive restructuring, it helps modify the unhelpful trauma related beliefs. For example, if I am permanently broken, okay. So relaxation techniques में होता है कि अगर उनको flashbacks are रहे the people are having like hyper arousal or flashbacks or they can't sleep at night. So in CBT, it will actually help them to first of all recognize the cognitive restructuring and helping them to replace the negative thought pattern to the positive one. Okay. And relaxation techniques may, of course, the breathing awareness, then PMR, which is progressive muscle relaxation. And we have relaxation techniques, then, we have this diaphragmic breathing, where you have to first put your hand here on your heart or on your chest, and then one on the stomach. And then just breathe. So after a time, your stomach will be bloated. Once you're breathing out, when you're breathing in, and when you're breathing out, your stomach would be in. Okay, so this really helps in regulating your physiological responses when it comes to stress. Okay, so then another technique in breathing exercises or breathing awareness is if we talk about the square technique. Okay, so 4 4 4 4. So 4 seconds you have to breathe in, like 1 2 3 4 and in, and then hold the breath for 4 seconds, then release the breath for 4 seconds, and then just maintain the breath for 4 seconds. Okay, just maintain that. So these are also very, very helpful in terms of when a person is going through anxiety and stress. Okay. So in evidence-based supporting CBT for PTSD, the studies, they have shown that CBT significantly reduces PTSD symptoms with effects lastly years post-treatment also. Okay. And yeah. Let's move to CBT for obsessive compulsive disorder, which is OCD. Okay, so it helps OCD, the and very particularly it helps in exposure and responsive prevention, and most evidence based and effective treatment for OCD. Okay, so ERP is emotional and exposure and response prevention. Exposure and response prevention, exposes individuals to their fears while preventing the compulsive behaviors. Okay, so it helps challenge the irrational obsessions and intrusive thoughts, and reduces the compulsive rituals and avoid the behaviors. So evidence based supporting CBT for OCD, इसका evidence हमारे पास क्या है? ERP based CBT, so it has a 80% of a success rate by reducing the OCD symptoms. Okay, and studies indicate that CBT is more effective than the medication all alone. Medication तो अकेले तो कभी नहीं करनी चाहिए. It should be like a collaboration between the medicine and the therapy that has been happening for a long term relapse. Then CBT for substance use disorders. Okay, so CBT is used in addiction recovery. So first of all, they will help you in identifying the triggers for substance use. कि आप क्यों करते हो? Why do you go ahead with the trigger? Like why do you take that sip of alcohol? Or why do you smoke? So that why is something that CBT will look after that. It helps and uses the urges surfing techniques to manage the activities, and then helps change the maladaptive reward seeking behaviors to a better ones. Now CBT in insomnia is also there. So CBT insomnia, CBTI, is the most effective non-medication treatment for sleep disorders. Now, it helps challenges the negative thought pattern about the sleep. Then it uses stimuli, control therapy. So stimulus control therapy hoti hai to associate the bed with sleep and not other things with bed. Like for example, if a person has been sitting on the bed and watching the TV, so the mind will associate कि वो bed पे you're watching the TV and you are you're watching the TV, so sleep, sometimes there is a problem with sleep, but stimulus control therapy will actually help the person associate the bed with the sleep itself. Okay, so all these disorders like depression, anxiety, PTSD, OCD, substance use, and insomnia, it has a very, very evidence-based application for CBT. Okay, so why CBT is a good treatment or a very good treatment is because it is backed by a lot of research and clinical trials. So all these have been treated and they have been solved by a lot of therapists, and only then it has been provided to students that they can actually learn from it. And structured and time limited. Okay, so typically 8 to 20 sessions it takes according to the variety and according to the range of the problem. Then teaches a lifelong skill to help individuals manage and mental health independently, and adaptable for various disorders and different kinds of a population, right? It is just not restricted to these people or this age group. It is a very good variety. Then CBT continues to be one of the most leading therapies that psychologists will still give it to a lot of patients. Okay, and offering a structured evidence-based method to address the wide range of psychological conditions. Okay, so here we have given you a lot of evidences that NICE Foundation, APA, and a lot of yeah, a lot of different kinds of big therapies and a lot of big kind every so a lot of APAs and organizations, they have given these evidences while they are doing the clinical trials, and still people are doing it. So CBT has been backed with a lot of evidences, researches, and a lot of clients also. Okay, so of course, please use these techniques and you do a lot of homework with your clients. There are a lot of worksheets. There is a lot to give it to the client also, so that they are not completely dependent on you. Rather, it is more of a collaborative thing here. All right. So I hope that you like today's class. And if there are any doubts, please use the LMS community section to put all your doubts in there, and we'll be happy to answer them. Thank you. Bye.